All right, hey, what's up, everybody? Michael. So I did my interview with a clinician. Was like a kind of like a friend of my fiance's. Yeah. First question was, what are your personal beliefs about medication? He believes that medication can be a valuable tool in mental health, especially when combined with therapy, lifestyle changes, and support systems. However, medication can be overused in, in pain, anxiety, and antidepressant medication can be problematic. If side effects are so severe, they can't stabilize and do therapy. Or if side effects are so severe, they can't stabilize and do therapy. um, he said that as a culture, we depend way too much on medication, both prescribed medication and then medicating ourselves with things like drugs and alcohol. Next is, what experiences, clinical and life, have led you to your beliefs about medication? He said that he was diagnosed with clinical depression and was prescribed Prozac. It made a dramatic difference in his thinking and mood and removed what he felt was like a block of melancholy. It helped him focus on being positive and motivated. Um, yeah, the same kind of change can happen with clients over time, he thought. Because of his experience, he learned that medication can be vital in helping clients manage severe conditions like anxiety and depression. However, he also has seen challenges like side effects and medication dependency, which highlights the process of finding the right treatment. It solidifies his belief that medication should be part of a broader mental health plan and not a standalone solution. So next is it your practice to ask about medication and or medical history? So he said that he asked clients medication and medical history for several reasons: to ensure safety by preventing harmful interactions, understand their mental health management and past treatment challenges, collaborate with healthcare providers for line care, and to build trust. This ensures that there's informed holistic care, and it fosters open discussions about their treatment choices. And he does that at intake, and it feels like it should happen. The medication and medical history should happen at intake. So as, did you find your master's level training on psychopharmacology was sufficient for your practice with clients on issues related to medication? What tips do you have for staying up to date and informed on this evolving field? So he said that his master's training in psychopharmacology provided a general overview, but this was enough of a basic understanding of how all drugs can affect people both positively and negatively, and the ways to manage that. When a client who needs medication management, or if there's a client who needs medication management, he'll ask what medications they are on and plan or create a plan around the training he received in psychopharmacology. So next is, have you ever had a client who was experiencing severe side effects? How did you handle that situation? So he's assisted clients in managing severe medication side effects, which can be emotionally distressing and cause doubts about treatment. In one case, he had a client who was on antidepressants. His client experienced dizziness, sleep disturbances, and anxiety. He addressed this by listening and validating the concerns of the client, exploring the different side effects, consulting with the prescriber, and discussing alternative treatments. and he also provided some emotional support and regularly reassessed the treatment plan. Um, so, do you have any? I asked him, do you have any resources that you utilize to help clients outweigh the pros and cons of medications? What are the resources you use? So, he uses a variety of resources, but he said that online databases are some of the ones he uses the most. He understands, he also likes to understand the client's attitude toward medication and then guide them to the most relevant sources. He also likes to empower clients to make decisions aligned with their values and mental health goals. And he also says that the prescribers themselves can be useful resources in weighing the pros and cons of medication. Alright, so next one is, have you ever had a client who changed your views about medication after witnessing them on medication? If so, what was that like? So one client's experience with medication deeply impacted his perspective on its role in mental health treatment. Client was struggling with depression and anxiety, and they tried therapy and lifestyle changes with limited success. They were hesitant about medication due to concerned about side effects, but they decided to try it. Over time, their mood stabilized and the anxiety decreased, and they became more engaged, playing with therapy and personal goals. All right. Next is, what does collaboration look like? Has there ever been a time when you disagreed with the client's physician, psychiatrist on the medication prescribed to them? How did it work out? So he said that collaboration between a counselor, client, and prescribing physician is essential for effective mental health treatment. As a counselor, he offered feedback on how clients respond to medication, observed emotional and behavioral changes, and empowered clients to communicate with their doctors. Key aspects of collaboration include open communication, client empowerment, and sharing observations with the prescribing physician and providing emotional support. In rare cases of disagreements, he prioritizes the client's well-being and facilitates adjustments to the treatment. So next is, did doctors and psychiatrists you've worked with speak with you about a plan for medication that is short-term? How was that for you? So he ran into more psychiatrists and doctors that were focused more on long-term medication plans, but there was also some that have been focused on short-term plans as well. He's developed collaborative relationships with those doctors and psychiatrists that do focus on short-term medication plans. Next, ask him, I've been learning about having an exit plan when it comes to medications. Is that something you discuss with your clients? How do you prep them to have that conversation with their doctor or psychiatrist? So he said that creating an exit plan for clients on medication is an essential part of his practice, and if he finds out a client is on medication, he speaks with them about setting up an exit plan. He always works to provide support to his clients when they are talking about having a conversation with their doctor or psychiatrist about tapering off medication, giving them the confidence to speak with their doctors or psychiatrists, and letting them know he will follow up as well. So next is, have you ever felt as though your client is not best served on the medication that they are on based what they share in therapy? How do you bring this up with the psychiatrist? So he says that he prefers to document the responses clients give him about medications that they are on, whether it's increasing severe side effects, new side effects or increased dosages so that he has that available to bring to their psychiatrist or doctor if necessary. He wants to be collaborative gosh, with psychiatrists and doctors, so he lets his clients know, or lets the doctors know what his clients are telling them. All right. Last one is, to what extent or what detail is it good to know about medication in order to be helpful to the clients? So he said that understanding the effects of medication is more helpful in his view than having a working memory of all common medication. He can always research a specific drug that his client is taking. It is far more important to understand medication can be helpful to some clients and harmful to others. Having that awareness of how medications are affecting clients is more important than having extensive knowledge of medication. All right. Thanks, guys. That's it.